During the olden days, it's very difficult for somebody to get stroke. Okay, during the olden days, very difficult. Nowadays, even at the age of 20 or 25, somebody can get stroke or stroke can set in. It's all about lifestyle and some factors. Okay, and according to scientists, they discovered that young adults between the age of 18 to 25 are now getting stroke more than the grown-ups. And they were trying to find the factors, or they were trying to find why this is happening. They have written some factors down, okay, and these factors, we are familiar with them, and I'll try and break these factors down. The factors that can increase your risk of getting stroke, especially the young adults. The first factor that came in mind is what? Lifestyle. Okay, the lifestyle that the youth are living nowadays, Charlie, is very crazy. Okay, they live the life to the extent that they don't care about themselves. They do what they want to do. Example, sedentary lifestyle. Okay, they don't they sit at one place for a long time. They don't exercise and they eat anyhow. They don't want to do anything that will stretch their body. Okay, they don't want. Another factor that can increase their risk of what? Getting stroke is smoking and alcohol. When you go out and you see like young adults smoking and drinking alcohol, like, you'll be surprised. They smoke to the extent that sometimes, like, I don't know, they are addicted to it, that every day some people they are smoking, even though they've written on the packet that it's not good for our health, but still somebody can smoke just like 3 packs within a few hours. All this lifestyle, smoking, taking alcohol continuously, can increase your risk of what? Getting stroke. Another factor that is what? Artificial sweetness. The manufacturers, they let us know that they are replacing the natural sugar with what? Artificial sweetness, not knowing that artificial sweetness are even more dangerous than the what? The natural sugar. Okay, artificial sweetness can increase or can cause a lot of cancer and other health conditions, but they've get into your mind to the extent that every food that they've is out there, the processed food or energy drink, there's artificial sweetener in there. And those drinks, someone is taking it every day. Okay, with all this, it is very easy for you to get stroke. Okay, and stroke happen when your brain is not getting enough oxygen and nutrients, and blood is not flowing up there. You can easily get stroke. So these artificial sweeteners, they are factors that can prevent your brain from getting the blood and other nutrients that they needed to function properly. So if you are someone you like taking these drinks or any processed food that contain artificial sweetness, kindly stop. Other factor that can increase your risk of getting stroke is too much intake of what? Sodium. Some people, when they are cooking, they will add a lot of salt to their food, and some processed food are there. When you taste them, you a lot of salt. You eating this food continuously will not do what? Any good. It will just increase your risk of what? Getting stroke. It will prevent your brain from what? Getting the blood and other nutrients that they need to function properly. So please, kindly reduce the amount of salt you take per day. Other factor that can increase your risk of getting stroke is what? Chronic conditions. I'm talking about diabetic, I'm talking about general infection, any condition that is very related that you are trying to treat. Don't let it end there. Make sure you treat them completely. Some people, when they started treating certain infection and they feel okay, that is all. They don't follow up and see the thing is totally gone. Any disease that you are treating, make sure you treat it properly. Don't just end on the way. because as the condition is there, it can what increase or prevent blood flow to your brain, thereby leading to stroke. So please, if you have any chronic condition, make sure you treat it well. Another factor that can what increase what your risk of getting stroke is high blood pressure. Most people have high blood pressure, but they don't have any idea. Some of them, when they check it is high, that is all. They don't follow up. When your blood pressure increases consistently within a period of time, you can what get a stroke. So please make sure you monitor your blood pressure and bring it to what the normal level.